Welcome. This course is about helping pain on the forearm, on the anterior side of the forearm, on the hand, on the palm, and in the fingers. And specifically in when you try to extend your fingers if you have pain on the front side of the fingers, so you can't extend. That can be caused by pain inside the hand, and it can be caused by pain coming from the muscles that form tendons that come up into the fingers that actually start in the forearm. And there's two sets of muscles called the Flexor Digitorum that we're going to go over. The deep Flexor Digitorum is called Flexor Digitorum profundus, and it's very interesting because it forms tendons that go through ringlets in the Flexor Digitorum superficialis, the one that flexes the fingers. It has four tendons that run directly above the profundus, and that forms ringlets. The ringlets attach to different bones than the profundus do. The profundus goes all the way out to the final digitorum, or the final phalanx of the the finger bone of the finger for each finger, and the Flexor Digitorum superficialis that forms ringlets actually goes around the Flexor Digitorum profundus and attaches to the second phalange of the whatever finger that the tendon goes to. I don't know if that makes sense, but you'll see in the pictures. And basically, pain in the fingers can come from the forearm. Pain in the fingers can come from muscles of the hand, and pain in the hand can come from both of those. And then there's a movement called supination and pronation. Supination is when you turn your palm up, or when you turn your forearm up, your wrist or your forearm or your palm, your hand, so that your palm is facing up. Your feet cannot do this, so your feet cannot actually supinate, and your feet cannot actually pronate. Those terms are incorrectly used sometimes, but your hand definitely can. And when you turn your palm facing down, that's called pronation. Sometimes those movements are limited, and especially when you have hand pain and pain on the front of the forearm. So these all kind of go together, so that's why they're all in the same class. So it's a great class for learning how to fix exactly all those problems. We'll go through exactly which muscles can cause each, so you'll understand what to release and which muscles to release depending on where people have pain. And it's a pretty long course, but it's very informative. So enjoy, and we'll see you on the other side. Welcome to the Releasology family. Since supination and the pronator muscles can interfere directly with the flexor digitorum muscles, we really want to go through these first before we get into the forearm muscles in the hand. So let's talk about the pronator muscles and supination. But there's one set of muscles that can cause trouble. It's called the pronator muscles, the pronator teres and the pronator quadratus muscle. The pronator muscles, basically, they pull the radius over onto the ulna, and they smash the space in between by trying to cross the radius over the ulna, and the flexor digitorum tendons pass, through that space. So they can really get caught up by the pronator quadratus and the pronator teres. So let's release these muscles. Let me show you where the release points are for the pronator teres. The pronator teres comes from the medial epicondyle, and it heads over to the radius. And when it contracts, it flips the thumb over the ulna side of the wrist, So it's like if you're going to look at your wristwatch or something like that. And the way to stretch it is to hold the thumb side open. So you're holding the wrist open all the way from the elbow up here. And you're doing pressure point release right where the muscle comes off of the medial epicondyle while you're holding the stretch. So you stretch and brace at the same time, holding the pressure point, increasing your pressure. See my thumb's turning white. It's called the Yang cycle. And then what you want to do is slowly back your pressure out. Slowly back out, make it feel like you're backing your pressure out even though you don't really go anywhere. If you can make it feel like you back out at the same time that you don't really go anywhere, you will trigger a release. For some reason, the trick with creating the energy flow through your body to the ground is in that motion. When you back out and you make it feel like you're backing out, but you don't really leave. Do you feel the energy while you do this? Make sure you get it completely. Okay, let's go ahead and check out the pronator quadratus. So the pronator quadratus is the other pronator in the forearm, and it's down by the wrist. It comes across from the ulna to the radius. All muscles in the body called pronator are four-sided. They're not exactly square, four-sided shapes. Let me show you a picture. So the pronator quadratus comes from the ulna and heads over to the radius down by the wrist, and it can trap the median nerve along the way. So it's really important to release this in order to release the palmaris longus and the other vessels and so on that pass through the wrist. So the release points for the pronator quadratus are over on the radius side of that muscle that I just showed you on the picture. And the way to stretch it is to hold the wrist into supination, right? Because it pronates when it contracts, so supination is the way to release it, or to stretch it. So this is the way to stretch and brace it with the other hand. And hold the pressure for about maybe 30 seconds to 60 seconds, slowly increasing your pressure with more and more intensity. Sometimes you have to reposition a few times to feel like you get it right. But the motion that you want to stretch it in is this way. That's supination. So let's start the yang cycle. Focus your energy, attention, and pressure all into the pressure point of this pronator quadratus muscle while you're holding the stretch and intensifying the pressure. While you intensify the pressure, also intensify your focus and make sure you're really right in the middle of the center of where you feel tension. Don't press into some random spot. Make sure it's the middle of the tension that you're trying to release. And then slowly back your pressure out. Try to make it feel like you're backing your pressure out while you actually don't go anywhere. This is called the yin cycle. If you do it right, the muscle will begin to feel like it's deflating. It'll begin to relax, and you'll feel the wrist and the thumb open up all the way. It'll feel like the thumb can open up all the way in this position so it can easily touch the table, where before it wasn't really wanting to lay flat on the table. Well, that's it for pronation and supination. Go ahead and try all these techniques. Good luck, and study the anatomy. Don't forget to do that. I'll catch you on the next video. Talk to you soon. How to release the flexor digiti minimi muscle of the hand. Situate yourself in a stance that utilizes your leg and core muscles to transfer power from the ground directly into the release point. Position the muscle so it's stretched and accessible. Cross-fiber palpation is when you feel back and forth across the fibers of a muscle to determine its tightest fibers and its tightest points. Its tightest points are release points. The first rule of Releasology is to do no harm. If you are not sure what you're pressing on, don't press. Muscles are safe to press on with a lot of pressure, but other structures are not. Avoid pressing into bone, cartilage, nerve, or anything that causes too much pain. Are you ready to press into the release point? Okay, let's do it. Focus your attention, pressure, and energy into the center of the release point until you are there, into the center of the release point. Stretch the wrist into extension with one hand while you press into the point with the thumb of the other hand as shown. This initiates the yang cycle. To release the point, make it feel as if your pressure is withdrawing while you hold firm. If you can create both of these sensations at once, the muscle will begin to release. By making it feel like you are withdrawing your pressure while you actually hold your ground, you initiate the yin cycle. The muscle will feel like it's deflating until it releases. If you pay attention, you may feel a flow of qi from the release point to the ground passing through your body. Some can even feel a sensation of warmth along the path. Repeat this process using the technique shown until the muscle is completely released. Enjoy the music while you practice. Release this muscle for the first time. Please practice the memorization exercise for it at least 3 times. If you are working through a Releasology topic, return to the list of muscles and continue releasing them. Or its paired channel, and then return to this muscle for a much easier experience. Keep on practicing Releasology because any muscle can be released. If you've already released the forearm muscles, these are the muscles that you have to release if someone still has hand pain and finger pain, especially in the palm and the index finger and the thumb, and deep down in the palm. Okay, so try all these techniques and see what you think. So are you having fun yet? All right, we've talked about the extensor muscles. We've talked about releasing the flexor muscles. The extensor digitorum we released when we were talking about tennis elbow. And then we released golfer's elbow, which is the flexor muscles from the medial epicondyle. And we talked about pronation and supination. Now let's talk about the thumb. So people have thumb pain on a regular basis. Let's talk about this muscle here. This is the what I'm doing is I'm adducting the thumb. I'm pulling it towards the rest of the hand. And abduction is when the thumb is pulled away from the fingers. So this muscle actually abducts the thumb when it contracts. And you have to adduct it the way I was doing it to stretch it while you do pressure point release with the yang-yin pulse. Now for the muscle that brings the thumb back towards the elbow along the dorsal side of the forearm. So this is called the extensor pollicis longus muscle. It comes from the back of the forearm where I'm pressing, and you have to stretch the thumb at the same time, which is called flexion of the thumb, and hold the pressure point while you slowly release it. Okay, now let's show you the adductor pollicis, and it's anchored at the third metacarpal bone, and the insertion is right onto the sesamoid bones, just right kind of attached to the base of the thumb there. And you want to stretch that insertion away from the middle of the hand. And while you're stretching it, you're increasing your pressure and you have to really like stabilize the hand. At the same time, which you can do with your hand like this. See how I'm like using my other hand to like brace it and kind of keep my finger in there as a way to block it in, and then I'm squeezing into a pressure point release, doing yang, and then slowly backing my pressure out to trigger a release, doing yin on with the thumb of my left hand on your right side of the screen. Hope that made sense. So that's how you release the adductor pollicis, and now we're going to do flexor pollicis brevis. The flexor pollicis brevis ends at the sesamoid bones at the base of the thumb. So the thumb that I'm using to stretch the tip of her, or like the end of her thumb with, that's just using the thumb as a lever. That's not really where the tendon is. The flexor pollicis brevis is down where my other thumb is, the one that's closer to her wrist, and I'm stretching it, using both hands. But I'm pressing into the pressure point right in the middle of the muscle down between her wrist and the sesamoid bones of her at the base of her thumb, and increasing pressure with the stretch. And then I'm slowly starting to back my pressure out to trigger a release. And I'm in yin mode, and okay, I think I got it to release. This is the flexor pollicis longus. As you can see, it's longer. It comes from the lower part of the forearm, basically. And the tendon comes up much further. It comes past the sesamoid bones onto the proximal phalange of the first phalange of the thumb. That attaches kind of at the base. So what it does is it brings the thumb down towards the forearm when it contracts, and I just showed you how to do the release. Let's show you the index finger. If someone has index finger pain, when they move it, it hurts, or when they point it, it hurts. It's either on the front or the back. So let's show you all the releases for all the muscles that attach to the index finger, just how we did for the thumb. So this is the flexor indicis muscle that I'm releasing. What you have to do is you have to pull the index finger back, and you press into the body of the flexor indicis, where my other thumb is, on her around her wrist, and you hold the stretch and the pressure at the same time. You increase the pressure at your point and try to trigger a release by slowly backing your pressure out over quite a while, maybe 20-30 seconds. And once you feel a release, you'll feel the muscle start to soften as you make it feel like you back out, even though you don't really go anywhere for the whole time that you're trying to back out. So let's now show you the extensor indicis. The extensor indicis muscle is a small muscle that lifts the index finger. It comes from the back of the forearm. Let me show you the path. It comes from right about there, and that's the origin. The insertion is out there at the tip of the index finger. So what you want to do is position yourself, use a little cross fiber palpation to check where it is, meaning going back and forth, side to side over the tendon a little bit. And once you got it, then go ahead and stretch the index finger down towards the anterior side of the forearm, stretching the wrist and taking the slack out of the muscle while you feel it stretch. Let's try that again. And what you want to do while you stretch the muscle is, by pulling the finger down towards the forearm, is press with your thumb into the body of the muscle and try to get into yang mode, where you're trying to focus into the pressure point, really trying to pressure point right into the center of it. If you can't really get into the middle of the muscle, you can't release it. So the more you try to focus your pressure right into the center with a lot of concentrated, focused energy, you'll get there. So once you get into the middle with a lot of pressure, then start backing your pressure out. Slowly make it feel like you're backing out, even though you don't go anywhere. See how long it's taking me? I'm making it feel like I'm backing out all this whole time. So I actually started ahead of the cueing here, but that's the idea, is like you focus your pressure in and then you back your pressure out. Make it feel like you're backing out while you hold the stretch and you hold the pressure at the same time. So just make it feel like you're backing out, but don't really go anywhere. See what I'm saying? You make those sensations happen at the same time and you'll trigger a release. You can see the color of my thumb changing as my yang and yin mode change. And it looks like I got a release. Okay. So if you really feel this work, a lot of times you'll start to feel like a sense of opening, or like a movement of energy, what I call the energy, from my point of contact with the pressure point all the way to the ground. And hopefully you do too. Try this technique over and over until all the muscles are released. You know, anatomists say that the thumb is the first finger and the index finger is the second. So if people complain of the second, third, and fourth finger hurting, these are the muscles you need to release. I start with the lumbricoles. The lumbricoles are long muscles that take off from the flexor digitorum longus muscles. They're like ribbons that kind of help with flexion. They come from the actual tendons of the flexor digitorum longus, and they ribbon up to their attachment at the dorsal expansion of ligaments. It's kind of like a basket of ligaments around the knuckles. And there's one lumbricole for each finger. It kind of ribbons up, under the skin to the knuckles. And that muscle can work with what are called the interossei muscles to both flex and hyperextend the fingers. So they travel under the skin along the side of the finger. So you can actually find them by getting a hold of the bones of the finger. Any finger will work, and you mobilize the finger forward and backwards. And if you pinch right here, you'll feel the muscle on the back and the front catch under your finger. So this is a way to find these little muscles, and they can be in spasm. And the idea is you want to stretch them and hold pressure points. Make it, they're small muscles, so you can't go crazy, but, focused intense pressure to, during the stretch is yang mode, and then slowly release your pressure to get releases in these muscles. And you can open up a lot of problems with the fingers. Like, for example, if someone's fingers won't straighten all the way, if they have like a hammer finger, the same thing works with the toes, actually, by the way, the same kind of setup. You can release these sometimes and it'll straighten out. Like I said, these muscles work with the interossei muscles to hyperextend the fingers. So if someone all of a sudden can't do that movement, it's definitely because either these lumbricoles or the interossei muscles are in spasm. So the way to release them, like I said, is to find the muscles as they travel up, through the skin, right under the skin, between the bones. You can find these little muscles, and by bringing the finger bones forward or back, you can have these muscles wrap right up around the thumb or finger that you're trying to do pressure point release with. And when you catch them, you can use that to stretch the muscle by stretching it over your finger. Hold pressure, intensify that pressure to tell the muscle, you really want it to let go. And then slowly back your pressure out to trigger yen mode, which releases each of these muscles. And I know it might seem like a lot of work to do all of them, but it can definitely be worth it to do each one of these, especially if someone's having pain in their fingers. So let's look at the muscle or tendons that go to the smallest finger. This is the digiti minimi, or the small finger. This is the flexor digiti minimi. It's a small little muscle on the front of the hand, and what it does is it flexes the small finger. So if someone's having, all the other fingers are fine, but when they try to straighten their little finger, it hurts. Or when they try to flex their little finger, it's kind of like weak and just tight. It's potentially because of this little muscle. So what you have to do is you have to find the body of the muscle and then firmly press into the center of it, and then slowly back your pressure out, making it feel like you're backing out, even though you don't go anywhere for a while until it releases. So let's show you the extensor digiti minimi. The extensor digiti minimi is a muscle that comes up onto the back of the forearm, and that extends the small finger. So do the same thing with that. Here's the abductor digiti minimi. It's the same thing with that, where you do stretch the finger towards the middle of the hand and do pressure point release on the outside of the palm on this one instead of in the back like on the extensor. And so watch, we'll stretch the small finger in towards the other fingers, and we're going to press on the outside of the muscle, forcing the finger into adduction or stretching it into adduction while we do very focused pressure right into the center of the body of the muscle here. See? So that's yang mode. And I'm going to slowly start backing my pressure out and trying to trigger yen. So yen is when the muscle starts to release. And you get that by slowly backing your pressure out over like 30 to 60 seconds. If I can just keep my balance here. I keep like slipping off, but there we go. Okay. So now I'm doing some good yang yen pulses. You see it? So I'm holding the stretch, and then with my index finger, I'm going in, holding the pressure, and then slowly backing out, making it feel like I'm backing out even though I don't go anywhere.
triggering the releases. It's softening up. So I'm going to do it a few times until I feel like it's really released. So it's basically, this muscle is the whole outside edge of the palm, under the little under the small finger. So remember to make it feel like you're backing out, even though you don't go anywhere. If you can create both sensations at once, the sensation of backing out, where you actually don't like take your pressure off, but make it feel like you're backing out, telling the body that your pressure is drawing away while you're also holding a lot of pressure at the same time, that triggers the yin flow. Yin flow will make you feel like energy is flowing from the point of contact all the way to the ground. I know I'm saying it over and over, but you know, that's the trick. So I want to make sure you get it. So do it over and over until it releases. Oh, this is a by the way, the palmaris brevis is the last muscle in this section. In fact, it's the last muscle of the upper limb. And the palmaris brevis is named after the palm. What it does is it curls the outside edge of the palm in towards the middle of the palm. Imagine if you were trying to hold like one drop of water under your the outside of your palm, and you needed to bring the outside of your palm up to kind of like form a cup. That's the muscle that does it. So that muscle can actually cause just a little bit of pain right under the skin there. It happens. And the way to release it is to stretch the kind of traction the outside edge of the palm, and stretch the palm there away from the center of the palm. You know, basically like right under the skin. And you can actually get releases there. And releases there can, it's supposed to actually help the lungs in reflexology, in hand reflexology, by the way. So anyway, just like any other muscle, you focus your pressure in while you're stretching to really pinpoint it and penetrate into the center of the point. And then once you feel like you're penetrated in, then you slowly back your pressure out until you feel like it melts. And you got it. Okay. Thank you very much for watching all the way to the end of this video. This is generally the case for all the extensor muscles, which tend to be tighter than the flexors. So let's do the flexor muscles, which all come from the medial part of the elbow, and that's where carpal tunnel syndrome originates, and it's also what's called golfer's elbow. Hold points on both the origin and insertion side of this flexor carpi radialis muscle, but the best pressure point is actually up towards the elbow. So try to release it there while you're holding the stretch. Increase your pressure slowly into yang mode, and then start to back your pressure out, triggering the release in yin mode. Now, let's try the palmaris longus muscle. The palmaris longus is the carpal tunnel syndrome muscle, by the way. This is the one that causes it. So it's the same technique. Hold a stretch, and then slowly go into the pressure point, increasing your pressure, and then start to back your pressure out, triggering the release. This is what releases the pressure point on this palmaris longus muscle. And this should release carpal tunnel syndrome, because carpal tunnel syndrome is when the tendon of this palmaris longus wraps around the median nerve. And if this palmaris longus is tight, it traps that nerve in kind of a coil, and will pinch it all the time, and it'll cause horrible wrist pain. So the way to release it is the way I'm showing, where you stretch the wrist and you press straight into that muscle, and you do yang yin pulses repeatedly until it lets go. So let's try the flexor carpi ulnaris muscle now. The flexor carpi ulnaris comes from the same origin up at the medial epicondyle. Goes down to the ulnar side of the carpal bones. And what you want to do is you want to extend the wrist the way I'm doing to stretch it, and that holds the stretch while you can go into the muscle, which is, you know, a little bit more on the outside than the other two, because it goes down towards the pinky side of the forearm. But hold the pressure point in yang mode, and then slowly back your pressure out, trigger and release until you get it to let go. As it lets go, you'll feel the front of the wrist open up, and it'll just relax, and it'll almost seem like it gets longer. Now let's look at the Flexor Digitorum superficialis, which is the most superficial of the forearm flexor muscles that flex the fingers. So digitorum means fingers, right? And so it's really amazing how this muscle works. It's the most superficial of the two layers of muscles that flex the fingers. And one of these, the profundus, which is the deeper layer, goes through little ringlets in the tendons of the superficialis. So they both can engage the fingers at the same time. But the superficialis actually just flexes the, not the last digit or like the tips of the fingers, but the digit of the fingers behind